Okay, so we're going to talk a teensy bit about HIV. I don't get into HIV a lot because Ms. Durant covers that more in depth, and you actually get more of it next semester. But if a person with HIV becomes pregnant, there are some things you need to know. Antiretroviral therapy can be given in pregnancy that minimizes the risk of transmission to the fetus. There's actually a really good chance that we can prevent the fetus from getting HIV with those meds. So we really want to identify those patients early, get them on meds. C-section delivery is recommended to avoid contamination of the fetus with maternal blood. A fetal scalp electrode or fetal scalp sampling are contraindicated. We don't want to make a wound on the fetus's head and then have the fetus exposed to maternal blood. Breastfeeding is contraindicated in developed countries. There's an increased infection risk for women who are symptomatic. So women who have HIV and already have some symptoms are more likely to develop infections. And we already know that, but remember that pregnancy has some specific infection risk. Okay. Now let's talk about substance abuse. There are some things you need to know about substance use disorder. Frequently, people who abuse substances also have other mental health diagnoses. A lot of times they're using those substances to self-medicate for their other mental illnesses. There's a lot of controversy over whether people who are pregnant and using dangerous substances should be prosecuted. Typically, that tends to have the effect of causing people to hide. So encouraging treatment is probably a more effective intervention safety-wise. All women should be screened. All pregnant women should be screened in the initial history. We want to ask about medications and herbs. We want to ask about caffeine, nicotine, and alcohol. Don't ask people if they use illicit drugs. First of all, they might not even know what illicit means. Ask them if they use any drugs or medications that they obtain without a prescription. Okay, so we do want to know about non-prescription over-the-counter meds, but we also want to know, do you use any substances without a prescription? So that's going to include things that are legal but prescribed for someone else and substances that are not legal. Ask in an open-minded manner. You want people to be honest with you, so don't be judgmental. Urine testing is frequently done in pregnancy and in labor on the parent, on the person who's in labor. We also can test after birth. The neonate can be tested. They can do urine, meconium, or hair testing on the infant. Management, we really want to encourage people who are pregnant not to smoke or to minimize their smoking, smoke as little as possible. We want to encourage no alcohol. If they're heavy alcohol user, then withdrawal might need to be monitored inpatient, because remember, alcohol withdrawal can lead to seizures, which can be devastating for the fetus. If they're detoxing from alcohol, benzodiazepines can reduce that risk. Disulfiram or antabuse is contraindicated in pregnancy. We don't want to make them really sick in pregnancy. Other anti-alcohol abuse drugs have not been tested in pregnancy. If they're addicted to other substances, we want to encourage abstinence. However, if they're addicted to opioids, withdrawal is dangerous, and it's dangerous to the fetus. So the standard of care is methadone. We don't want them withdrawing from opioids in pregnancy. Patients who are taking methadone can breastfeed. So methadone is the standard of care for opioid addiction in pregnancy. Cocaine and methamphetamine are vasoconstrictors. Vasoconstrictors, I've been doing this too long. They can cause placental abruption, uteroplacental insufficiency, not perfusing the placenta well. They can cause fetal hypoxia, fetal death, preterm labor, intrauterine growth restriction. So they're pretty risky. We want abstinence from those. Breastfeeding is contraindicated if the mother uses amphetamines, alcohol, cocaine, heroin, marijuana. It is not contraindicated with methadone. People who smoke should not smoke in the room with the baby, and they should try to avoid smoking for 2 hours before feeding. However, breastfeeding is not contraindicated for smokers, and actually breastfeeding is can help decrease some of the risk that infants of smokers may face. The other consideration when we're talking about a parent who is has substance use disorder is whether that child is going to a safe environment. So that's another piece of the assessment. Okay, so we have finished pre-existing conditions.